Hello, I'm Jane Green, Chair and founder of Connective, which is a voluntary symptomatic hypermobility, Ehlers-Danlos syndrome, hypermobility spectrum disorder, neurodivergent, mainly autism, ADHD, dyspraxia group. And we formed in 2018, and this was after a couple of years before I had to retire, physically burnt out and probably mentally as well. And I only then received my diagnosis at age 54. So the background of this is when I was 16, I only had 2 qualifications and I was considered dim and I was often ill and I wasn't believed. So I learned to mask pain. And not only that, people didn't believe I even injured my various bits and pieces, or I was in agony from stomach gastro pain. And one thing I want to say here is that symptomatic hypermobility is not just joints, it's throughout our body. It affects all our organs, vessels, and so on, all our tissues, from brain to body to feet. So do remember that, that's really important, because I know a lot of people think, I can't be hypermobile, I'm too stiff. But that's part of it. So don't be fooled by the word hypermobility. So that's why it started. I had my diagnosis, but I had no support going forward. And I thought there needed to be real support. So I started Connective, which is to get funds in for tangible, practical approaches to our support, which we need. And this grew, and we started advocating in education, health, social care, employment, and transport accessibility. And people saw this was really important and joined, and we're all sort of symptomatic bar one, and we also have a steering committee, and it's really important that our voice is there, because our health issues are just not believed. They're very complex. They haven't just been disbelieved for my life, probably decades, even thousands of years. And you know, the key aspect of Autism Health, we die earlier more than any other group. I wonder why. And also being disabled or chronically ill, there must be very high statistics there. I don't know what they are. So these are the key issues for us. I think the joys of it, of being believed when we've lost every single bit of social mobility, our friends, the finance, obviously, because we've lost our jobs, and belief in ourselves. So that's one part of it, but also making a difference for ourselves is key. We know we should have a voice, and I believe everybody should have a voice who've not been believed, and we're also often carers. So we want to make a difference to those coming up, that they won't suffer like we did growing up, and they need to be believed. And I think it's incredibly important for the future that this stops this disbelief in symptomatic hypermobility. And we've got the evidence now. You can see it on the poster from our wonderful patron, and we've also got wonderful advisors who really strongly believe in what we're doing. So I think for the future, we're really innovative, and we're looking forward to doing more. This is our first poster, and I hope you like it, and we're really proud to have done it for Autism Europe.